So first of all, disclaimer, I am a board certified obstetrician. This video is not a replacement for prenatal care or medical advice. If you have any questions, call your doctor and seek medical attention in case of emergency. Hi guys, it's Leah. Welcome back to Mommy in the Moment. Today I wanted to put on my physician hat and talk about some common pregnancy symptoms that nobody really talks about. This information came from patients that I've talked to. Many people have asked me similar questions, and I also polled the audience. I asked some of my closest friends, what are things that they wish someone had told them about before getting pregnant? Pregnancy is such a special time. It's beautiful. It's magical. It is such a miracle. The more I've learned about it, the more amazing I find it. But sometimes it's not pretty. Sometimes it's not amazing. And it's good for us to know these things. I want you to have a comfortable and reliable place to get some of this information. So here are 10 common pregnancy symptoms that people don't always talk about. And I've got my notes down here, so I'll be looking down a little bit, okay? So the first one is constipation. Oh yes, constipation. So this happens early in the first trimester, sometimes before you might even know that you're pregnant. And it is very common. Most people experience it to some degree. It is caused by the progesterone, the hormone that relaxes all of your smooth muscle. So the muscle that you don't control. Those muscles are found in your gut, in the lining of your bowels, in your uterus. And that's why it helps to keep your uterus nice and relaxed so that it can grow. But when things move through your colon slowly, because the muscles are relaxed, it gets harder for you to pass it. Hence constipation. So little known, but very common symptom in the first trimester. If you're having trouble with it, then please talk to your doctor whenever you go and see them. Second is peeing. A lot. A lot of people think about increased urinary frequency in the third trimester once the baby is sitting on your bladder and your belly gets really big. But your kidneys start to go into overdrive. They are filtering your blood. Your body is like, we've got another human in here. We've got to clean things out. And your kidneys go into overdrive very early. So when I was pregnant, I was waking up 4, 5, 6 times a night to pee when I was 8 or 9 weeks pregnant. And this is completely normal. So if you're doing this at night, it's normal. If you're having pain, odor, or anything like that whenever you pee, that's something that you need to address with your physician. Vaginal discharge. Yes. It is normal to have increased vaginal discharge during pregnancy. The medical term for it is called leukorrhea, and basically it's increased white blood cells and mucus and fluid that comes from the vagina. White blood cells are the cells in our body that help to fight infection, and so basically this kind of flow outward with these white blood cells help to keep things clean and in balance. Now, you should never have an odor. You should never have irritation. So if you have either of those things, that might be an additional issue that needs to be addressed. If you also have, a quick change in your discharge where it's not just kind of a whitish, odorless discharge, but it's very mucousy or there's blood, then you also need to talk to your doctor about that. But a little bit of increased discharge that happens all the time, no odor, no irritation, very commonly normal. Many people will also have nausea beyond the first trimester. So we think about morning sickness and it happens early in pregnancy and then it goes away, but it's very common for people to either have a brief hiatus in the second trimester or it continues the whole time. One of the common causes for nausea in the second and third trimester might be reflux. Maybe you have acid from your stomach that's coming up into your esophagus. Some people feel that as true heartburn, and some people feel it just as nausea. So if you're continuing to have nausea throughout the pregnancy and nausea medication is not helping, then consider that it could be reflux or stomach acid, and it's maybe something that could be addressed as well. Round ligament pain. Now, my first pregnancy, I was a fellow in my high-risk pregnancy fellowship, and I was on call, and I remember during residency, people would come in at 2 o'clock in the morning, 4 o'clock in the morning with this round ligament pain. And it wasn't they weren't having contractions. They didn't have appendicitis. It was really, truly a very characteristic pain. And I was like, oh man, this is nothing wrong. It's safe. It's fine. They came in all at 2 o'clock in the morning for this. And then I had it. And I was like, oh, this is why people come at 2 o'clock in the morning, because they felt like someone stabbed them in their stomach and they're afraid for their baby. And the first time it happened to me, I was at work and I was like bent over at the microwave actually. And this is why people come in, because it hurts really bad. Now, round ligament pain is, if you think about your uterus, it usually is about this big. And whenever your pregnancy grows, obviously it becomes, the size of a human. And so the round ligaments are kind of like the strings on a circus tent, and they keep the uterus from twisting around. But it gets bigger and bigger. They stretch and stretch and stretch, and they can cause a pulling pain, usually on either side of your belly. Sometimes it's down low. Often it's more so with movement, or if you're getting up or you've been walking for a long time. Sometimes that pain, just because of the anatomy of the round ligaments, can shoot down towards your vagina. It's usually sharp and brief, and it's usually on one side or the other. Occasionally it'll occur at the same time on both sides. So if it's that kind of pain, it's likely round ligament pain. Other abdominal pain definitely needs to be addressed. So if you're having tightening of your belly, if you're having rhythmic tightening of your belly that comes and it goes, or rhythmic back pain, those are all things that you need to call your doctor's office or go get evaluated, because you don't want to miss preterm labor. But round ligament pain, short, brief, on both sides of your belly, sometimes shoots down towards your vagina, more common with movement, very painful, but very normal. Other pelvic pains down yonder. So there's a lot, your pelvis is doing a lot of adjusting and accommodating during pregnancy. The pelvis is made up of bones that have joints. They're not joints like your wrists and your elbow are, that have a lot of range of movement. These joints are shock absorbing joints. So they're not made to move, but they're made to absorb the shock of us walking and jumping and things like that. So the symphysis pubis, that bone right in the middle at the front underneath your mons, or the soft tissue right below your hairline, that bone can sometimes, that joint, the symphysis pubis, can sometimes get relaxed. There's a pregnancy hormone called relaxin that causes all this to happen. And as we gain weight during pregnancy, that joint can get a little bit of movement in it. And the muscles that go across that joint can start to spasm. The same thing happens with the sacroiliac joint, or the joints on either side of your sacrum. So you can get a sharp pain kind of right underneath where your butt muscles attach to your back. And that's worse if you put weight on one foot or the other, if you're getting out of bed or getting out of the car or going up and down stairs. Those are all very normal and very common pelvic pains to have. You can also have sciatica. So just like I said, your pelvis is trying to hold it together, and all the muscles around your butt, your gluteus muscles, your deep muscles, one called the piriformis, your sciatic nerve kind of comes right down in between that. And if you're having muscle spasm of the piriformis, you can have irritation of that sciatic nerve. Now, sciatica is pain that shoots down the back of your leg. And sometimes it can cause your knee to buckle. Sometimes it can cause you to lose your balance. So definitely discuss with your doctor if you're having pains like that. Again, not dangerous for the pregnancy, but all of these pelvic pains are very, very normal. And varicose veins. So most of us know what varicose veins are, or some people call them spider veins. They're veins that come up, and usually you see them in your lower leg. Sometimes you can see them in your thighs as well. It basically comes from the weight of the pregnancy making the return of blood from your veins more difficult. And so you can see some kind of dilation or kind of fattening of those veins underneath your skin and your legs. But little known fact, these can also happen in your hoo-ha. Yes, I, a physician, said hoo-ha. But yeah, so these can happen in your vulva, on your labia majora. I've seen this many times where people are like, what is this down here? And I'm like, oh, you know, that's a varicose vein. Anywhere that blood is having to return and kind of fighting against that weight of the pregnancy, you can have what we call engorgement or dilation or growing of those veins. Hemorrhoids are the same thing. They're basically varicose veins in your bottom, right around the anus and the rectum. So those are also, unfortunately, very common pregnancy symptoms. Swelling. Swelling is normal in pregnancy, and it can happen everywhere. So most of us know that you can have swelling in your legs, in your feet and legs. I definitely had to get new shoes because my feet were swollen. Also, just by gaining weight, my feet actually got bigger, so I needed a bigger shoe size. Never actually went all the way back, but that's another story. But you can get swelling in your hands. There's a certain point where I had to take my ring off. I had to buy a fake ring from Target to say, hey, I'm married, but I can't get my regular ring on. So that is a very common symptom. But even less common, or I guess a little less known, is you can get swelling all in here. Girls, I had swelling so bad in my throat that I started to snore. I had sleep apnea, which means you basically are choking on your own throat at night when you're trying to sleep. I had to get a CPAP machine to help me whenever I was sleeping because it was so incredibly uncomfortable. So swelling can happen everywhere, feet, hands, but also all in this area. If you have a sudden onset of swelling in your face, if you have headaches and blurry vision that's new, then you need to talk to your doctor about that, because that can be a sign of something called preeclampsia. A lot of people think about or know it as toxemia. You definitely need to be evaluated if it's a sudden onset increase in swelling, especially right around your eyes. So I know that there are more common pregnancy symptoms. If you have any pregnancy symptoms that you've heard about or you're wondering about, is this common, is this not? Comment down below. If you've thought of any, have you heard of any pregnancy myths? Any things that you're wondering about, comment down below. I'll make another video about that coming up. I think I might need to do a second edition of common pregnancy symptoms, because as I'm doing this video, I'm thinking of a couple of more, but we'll see about that. If you found this helpful, like this video. Again, comment down below. Let me know that you thought it was good. If you are pregnant, then congratulations, and subscribe, because I'm going to make more of these videos to kind of help walk you through some of the common things, not so common things, and then some kind of home remedies, things that you can do to make your pregnancy more comfortable. But thanks again for watching. This is Mommy in the Moment, and I hope this was helpful. Bye, guys.